Have you ever heard a joke that began with the words, "So this guy walks into a dentist's office"? No. And it's not likely you're going to either. You know, when you stop and think about it, we kid about everything in this life. We kid about art, sex, politics. You know, I've seen a number of films and videos about things dental, and let's face it, boring, just awful. They either show you horrible pictures of other people's mouths. I'm not going to do that. I'm not even going to let you see the inside of my mouth. We don't need pictures to scare us. Most of us are running scared of our teeth already. A friend of mine who's a dentist gives lectures about how to prevent tooth decay, and as part of it, he talks about the bacteria that work on our teeth. And at some point in the lecture, he says, "Would you like to see what the bacteria in your mouth really look like?" And he points over to a mic. Now, according to him, nobody in all the lectures he's ever given has ever once taken him up on that offer. And it's a good thing, because he bought the microscope at a yard sale. It doesn't even work. Now, this may be hard for you to believe, but this is not an infomercial. I'm not here to sell you anything. A fancy kind of sonic toothbrush, a special sort of whitener. I'm not trying to sign you up for any dental clubs. People who've known me and known the kind of trouble and pain that I've gone through with my teeth will stop and they'll say, "You know, there's something different about you." And before you know it, I'm explaining what it is that I'm doing that makes me feel better and that makes me look better. Well, let's do this once and then be done with it. The simplest way to understand how your teeth work is the model that you carry with you all the time. There's your tooth right there. There's the part, the business end, that grinds and tears and rips. The body of the tooth. And along here, at the neck of the tooth, that's called the sulcus line. That's where your gum fits up. Now below that, are the roots of your tooth. And those fit into a really interesting system of shock absorbers that then attaches to your bone, so that when your tooth is compressed, it's flexible. You know, I've heard some people say to me, the solution to teeth that hurt is to have them all ripped out and to put in falsies. Well, that always strikes me as like saying, you know, I get terrible pains in this arm all the time. I think what I'm going to do is have it cut off and put a prosthesis on it. Makes about as much sense. Do you want to have major operation and have all of your teeth taken out, or would you rather spend 5 minutes once a day to keep the ones you got? Because I'll tell you something, the ones they put in will never replace, never be as good as the ones that you lose. I'm not going to show you what to do just yet, because as important as it is to know what to do, it's just as important to know why you're doing it. I call it the drill. You know why I call it that? Because it's either this drill or the other one. So if this is such a great system, what goes wrong with it? Have you ever seen one of those archaeological digs where they bring up a skull that's almost disintegrating, thousands of years old, and you look at it, it's got a perfect set of teeth? Well, that's proof positive that if you take care of what you got in a natural way, you keep them forever. Your teeth will outlast you. The important thing, though, is to understand the enemy of teeth. And the enemy of teeth is bacteria. Now, our mouths, come to that, most of our bodies are full of bacteria, especially the insides of our mouths. It's a nice, warm, moist place for them to grow. The problem is not that they're there. The problem is that when they gang up, they start to build a shield around themselves and then start to eat into our teeth. Bacteria will take about a day to a day and a half to start building this wall. After about 3 days, the wall that they've built becomes almost waterproof, hard to reach with any kind of system that we have. And at that point, the bacteria starts working into our teeth, starts tooth decay, and then you've got serious problems. It seems so much easier when there's nobody here, doesn't it? You know, I don't know why people fear coming to a dentist's office these days, because every time you come, something new has been developed. There's either a new technique to reduce the pain and discomfort. There's a new technique to make your fillings look less like fillings and more like your own teeth. There's all kinds of things. I once had 3 root canals sitting in this chair, and for most people, terrible experience. But it meant something different to me. It meant that I was finally beginning to get a handle on what was wrong with my teeth. You know, for a lot of people, this chair and offices like this are a terrible place, a place they'd rather forget being. But you know what this place means to me? This is where the pain stops. Believe it or not, this is part of your dental health program as well. You see, what we eat has got a lot to do with how our teeth behave. The sugar, the bacteria, and the sugar that feeds it is an important part of the process of trying to ruin our teeth. And what we want to do is find ways of eating that's going to relieve the pressure, going to lessen that pressure on our teeth. Now, there's sugar in just about everything. There's sugar in this called fructose. That's the natural sort of level of sugar, the way nature intended it. Honey is about 30 times the concentration of the sugar in here. A spoonful of refined sugar, that white powdery stuff that we dust our sugar, our coffee, and our tea with, that stuff is about 1,000 times the level of this. And I'll tell you something, if you eat the natural things, anything that's alive, anything that will biodegrade, you're on the right track. And you know what? Not only your dentist is going to thank you for it, but your cardiologist and your internist and your general practitioner are going to be a lot happier that you're eating better, eating healthier. So even if you decide that you don't want to listen to anything anybody says about changing your diet, the way you eat, the amount of sugar you have, then that makes this next step all the more important. That means you got to do the drill at least once a day, and you've got to do it right. Now, the drill can be done any place. Anywhere you can get a cup of water to soak your brushes in, any place you feel comfortable doing it. And here's all you need. Carry your kit with you. That's all you need right there. This brush, which you may not have seen before, is a thin brush called a sulcus brush. S-U-L-C-U-S. You can mention that to your dentist, he'll be really impressed. The sulcus is the part of the tooth, remember, that's at the neck, where the gum meets the tooth. And it's right in there that the enemy builds up. All the bacteria start to build their home, form plaque, and eventually eat into your tooth. So the first thing that you want to do in the drill is to take the sulcus brush and interrupt that process, break up the camp, as it were. And all you do is take the brush at a 45-degree angle and put it between the gum and your tooth, and just rub back and forth in there, and then flick it up at the end. You don't even need a mirror to do this. As a matter of fact, it'll be easier to do it without a mirror. The next step is flossing. Now, everybody seems to go crazy about flossing. Oh, it's so difficult, it's too much, it's too hard, I don't know how to do it. It's simplicity itself. It's a funny looking kind of stuff, and it's meant to spread out as you use it, to work like a rag, to get down between your teeth and then spread out to clean what's in between them. Now, there are 2 kinds of dental floss. There's waxed and unwaxed. Now, the waxed is for the beginner. It's to help you get that. But the pros, like myself, much prefer the unwaxed kind because you get a better wipe with it. Here's how you deal with dental floss. Very simple. You take one end of it and you wrap it around, I prefer the middle finger, wrap it around your middle finger like that. Now, you pull out as much as you figure you're going to need, and you find that out through experience. You cut it off, you take that end and you wrap it around your other finger. You wind it up on there. That's your supply reel. Now what you've got is floss you can work with. Some people do it like this, some people do it like that, some people do it like that. It doesn't matter. Do it whatever way works. Talk to your dentist. He'll help you. You take that then and you work between the spaces between your teeth, and where you can, wrap it around your teeth. And you brush back and forth and you clean. And again, you work it up, around and up. If you're not sure whether you're hitting all the areas when you floss and brush, the dentist has a particular kind of yellow dye that he'll put on your teeth that'll show you where you're missing. But not everybody is able to do that. So why not use something simple? Have a dish of blueberries. Have a serving of beets. And the staining on your teeth will tell you where you're missing. Okay, once you've done the flossing, then comes the third and the final part, and probably the part that most people forget. And that's the brushing of your gums, massaging your gums. Now for that I use a normal brush, a bigger, thicker one like that. And I'll tell you something, you can use toothpaste or you can use a little bit of salt and water. Actually, you can do all the work you need to do with simply your large brush and some dental floss. You don't even really need a sulcus, a particular brush to do your sulcus work. It's just that it's a little bit easier. Now I'll show you something about toothpaste, and I'll prove to you that I'm not selling it. Most people like to lay on their toothpaste a long bead down the length of the brush. Well, you don't need that much toothpaste. I'll give you a simple way to think of it. Take and put a little bead across the brush using about 20% of the toothpaste you normally use. So look at it this way, already I've saved you 80% in your toothpaste. But that little bit is all you need to freshen your mouth. Once you've got that on your brush, then you begin to work your gums up, massaging them up and past the teeth. You brush the teeth only incidentally as you pass them. Mainly what you're doing is massaging those gums. The last thing you want to do, and this frankly is about the grossest thing you're ever going to have to do, is brush your tongue. Dentists suggest that because bacteria is held on the roof of your mouth and in your tongue as much or more than it is around your teeth, you want to take care of that. So brush across the top of your palate and then back across the tongue as far as you can go. It might make you gag a little bit here and there, but it's not going to hurt anything. And when you're done doing the whole drill, all the process, brushing the sulcus area, doing the flossing of your teeth, massaging the gums, and doing a final kind of brush to your teeth and your tongue, your mouth is going to feel fresher than it has ever felt. Okay, let's see if I've forgotten anything. You want to keep all the teeth you can possibly keep. The natural ones are way better than the store-bought kind. Number two, when you gotta have repair work, a dentist can help you. But a dentist can't make your teeth any better than they are now. That's your job. Number three, you gotta do the drill once a day to disrupt those bacteria. Once every day, a day and a half. Don't do it in pieces, do it all at the same time. You want to do it once, but you want to do it thoroughly. And as far as eating and the rest of the things go, you're going to do what you're going to do, right? So just remember one thing. You only got to floss and brush the teeth you want to keep. You're on your own now.